For those of you that don't know me, I'm Jake Rosberg. I'm the head athletic trainer at Fisher-Titus, and I also service St. Paul. And we got into this program, what was it, 3 years ago now? 2019, I believe, right before COVID hit. And because we were seeing a lot of injuries, specifically at St. Paul, but kind of all over the map. And so in trying to figure out what we could do better to assist our girls, reached out to Dr. Brown, who was aware of the Sportsmetrics program, which is kind of aimed at kind of basically training the girls to jump, teaching better landing technique, jumping technique, and aiming it at trying to reduce those ACL injuries that we were seeing over there. I think I had like 10 in my first 3 years. So we were high for sure. And so Dr. Brown attended the conference with Kelly, who will speak later, and myself. And with that, I'll kind of hand it over to Dr. Brown just to kind of go over the anatomy and the basics of ACL and the injuries.
Thanks a lot, Jake. So I'm Jason Brown. I came to Norwalk in 2014 directly out of fellowship. I did my fellowship in sports medicine after I did my orthopedic surgery residency down in over in Cleveland. Went back down to Cincinnati for an extra year of training. We got to cover Cincinnati Bearcats, Miami Redhawks. And if you're a coach, I know you've probably had at least one athlete who has had this injury at some point. So I grew up in Cincinnati, went to a large Division I high school, and played football and baseball. And I remember in 4 years, I only remember one of my classmates who tore their ACL. One. That was a pretty big deal. Nowadays, it seems like there's at least a few kids at every school crutching around during the year after having surgery for their ACL tear. So what can we do to try to keep this from happening over and over again so that our athletes can stay in the game?
With two big shots, one on Winslow and then this one, oh my goodness. Oh Lord. That is a serious knee injury for Willis McGahee.
Yep.
So this is a pretty gruesome knee injury that happened on the field. There isn't a whole lot we can do to prevent this type of injury, but there are a lot of knee injuries that we can prevent with proper training. Does everybody know who this is? This is Robert Griffin III. He played quarterback at Baylor, won the Heisman Trophy. He was drafted 2nd overall in 2012 by the Redskins, and then towards the end of his career, he kind of played with the Browns and the Ravens. After he got drafted, there was all this hype about the kind of player that he could be. So there were commercials and things. Watch real closely after this, right here.
All the numbers prove Robert Griffin III trains hard. And that he trains smart too, attacking record books with his fade. A low-fat, protein-rich Subway turkey breast with all the veggies the bread can hold.
Subway, the official training restaurant of Robert Griffin III and athletes everywhere.
So if we go back real quick, watch him jump. So not the best. So second season in the league, tore his ACL in the playoffs. This was actually his second ACL tear to the same knee. His first was in 2009 when he was still playing at Baylor. So we'll start with some background about the ACL. ACL is a large ligament. It sits in the middle of the knee, attaches to the femur or the thigh bone and the tibia or the shin bone, and forms a cross or sort of an X with the posterior cruciate ligament. And this is how these two ligaments get their name, because cruciate means cross. Its function is to provide stability to the knee by limiting the amount that the lower leg can kind of move forward in relationship to the thigh, and then also limits the rotation between those two bones. So how does somebody tear their ACL? Well, it can occur by being hit directly on the knee, like in the first video of the Miami running back, but the vast majority, as we'll mention later, occur without contact, usually with a twist, planting the foot to change directions, like in that soccer player, or landing awkwardly from a jump, like this professional kicker who tore his ACL while celebrating after kicking a field goal. You can injure other things than the knee when you tear ACL, like the meniscus, other ligaments, and the joint cartilage. So most often, ACL tears require surgery to reconstruct the ligament by using another tissue which is called a graft. Grafts can be taken from the patient themselves, which is an autograft, or from a cadaver, which is an allograft. And the most common grafts used are the patellar tendon, the hamstring tendons, or my personal preference nowadays is the quadriceps tendon, which is this picture up here. Which graft is chosen is largely surgeon preference. They're all good grafts. They can all have excellent outcomes. I personally very rarely ever use allograft for ACLs in my patients unless it's a special circumstance. After surgery, most people can return to work or school after a couple of weeks. They can walk and stand for longer periods of time after about 4 to 8 weeks. Typically, patients are on crutches 4 to 6 weeks until they regain enough strength to walk without them. They start running at about 4 to 6 months. Typical return to play is 9 to 12 months. And for our young athletes, this is a significant amount of time away from their sport. You can miss an entire year and multiple seasons, especially if you play multiple sports. I like to use Odell Beckham Jr. as an example because he tore his ACL October the 25th, 2020, while he's still with the Browns. He didn't play his first game again until almost exactly 11 months later, September 26, 2021. And then in the Super Bowl, he tore the same ACL again.
Is they're going to be more wary of putting him back in.
Then you see the awkward landing right away.
After this Durant situation. Wow.
So obviously needs help up. Danny Green's just trying to block that shot. That, as you said, Jeff, is not a dirty play. And as soon as...
So this is another good example. He had ACL surgery July 2019, and he didn't start practicing again with his team until 14 months later, September of 2020. And then unfortunately tore his Achilles a few months later. So, these guys, they're freaks of nature to begin with. They're built differently than all of us. They rehab every single day at the best facilities in the world. It can still take them a year or longer to get back to their sport. So why would I think that most of the athletes that I treat and take care of who never play professional sports, who have to go to school or they have to work, they can't go to therapy every day, why do I think those people can get back faster than these guys? Sometimes managing expectations of the young athletes and their coaches and their parents can be a very difficult part of my job. So there are approximately 300,000 ACL tears per year in the U.S. That leads to about 200,000 ACL surgeries being performed every year, and these numbers keep going up. 1 in 100 or 1% of high school female athletes suffer an ACL tear per year, and that may seem like a small number, but think of how many young women are participating in sports today. Like I mentioned before, ACL injuries are mostly non-contact injuries, about 70%. So what about the majority of the athletes that we all deal with here in our community? It's estimated that each year there's a 2% increase in ACL tears in high school sports. For boys, most injuries occur in football and basketball, and for girls, it's basketball, soccer, volleyball, and gymnastics. This was a study in the Journal of Pediatric Orthopedics 2015, looked at 10 to 14-year-olds between 2007 and 2011, and they found an increased rate of ACL injury of 19% and ACL reconstructions of 28%, and these are not insignificant numbers. So the question is then, why are more ACL tears happening over time? Well, reasons for this is that we're more aware of these injuries, that they're happening, so we can diagnose them better. There's also a true increase in the number of these injuries that occur. We've seen a change in pattern in sports participation amongst our kids. So, kids are participating in sports at younger ages. There are higher physical demands placed on them, and the whole way we practice sports, with a lot of kids focusing on a single sport all year round, even though they're in season for one sport, they're still doing activities for their other sport, and that leads to more acute and overuse injuries that are occurring in greater and greater numbers. So now we'll get into a little bit about why Sportsmetrics was created, and this was kind of what Jake alluded to before. Girls have a higher rate of ACL tears than boys. Depending on what study you read, the number can be anywhere from 2 to 8 times higher risk. Males still suffer more ACL tears overall because they have a higher exposure rate, but the relative risk is still higher in females. Girls younger than 17 have the highest incidence of ACL injuries. They took tissue samples from torn ACLs and people that were going to surgery. Half of them were men, half of them were women. They sent those tissues to the lab, and they found 3 genes associated with matrix regulation and collagen production, and found that there was actually differential expression between males and females. So a question that arises from that study is, are female ACLs actually weaker? There are also hormonal differences between boys and girls. There are estrogen receptors on ACL fibroblasts. Women produce relaxin and men don't. This can bind to the ACL. Higher relaxin levels correlates with ACL injury. One thing I even debated including in this presentation, but I did anyways, is there's some evidence out there that shows that taking birth control may impart some protection against ACL injuries, but certainly not a reason for all adolescent female athletes to start taking these medications. So the anatomic, genetic, hormonal factors, those are all intrinsic factors that we can't really change much, but there are some modifiable risk factors that we can focus on to help prevent ACL injuries. All these movement patterns listed here are ones that females tend to demonstrate, and is what Sportsmetrics aims to change. So jumping and landing mechanics for female athletes is typically much poorer than their male counterparts, and Kelly will touch on these in her talk. So after we've identified modifiable risk factors, we can implement programs to target these things and train our young athletes to properly jump and land, cut, all those things to decrease the likelihood that they'll sustain this injury during their careers. This was a program done in Italy back in the mid-90s. They followed 600 female athletes over 3 seasons. Half underwent a proprioceptive training program, and they found that there were 7 times the number of ACL injuries in the untrained group versus the trained group. So 10 in the train versus 70 in the untrained. Hewitt did a study in over 1,200 high school athletes. Some underwent a 6-week neuromuscular training program. They found a significantly higher incidence of ACL tears in untrained females versus trained females at 3.6 times the rate. And this program was kind of the early iteration of the Sportsmetrics program. This came out in 2005, the Prevent Injury and Enhance Performance, or the PEP program, and included kind of all of these phases here. So the creators looked at the efficacy of their program and followed adolescent female soccer players over 2 years. They trained almost 2,000 kids and had almost 4,000 also that they were following along. They found significantly lower ACL injury rates in those that were trained versus those that were untrained. There were only 6 ACL tears out of nearly 2,000 trained athletes and 67 in the 4,000 untrained athletes, resulting in a 70% decrease in ACL injury rate in trained versus the untrained. So what about, cost of these injuries? Well, ACL injuries are expensive. It results in an average cost of $25,000 for every patient, $5 billion total cost in the U.S. per year. One thing, though, that I think is much more valuable than money is time. Time's a limited commodity for all of us, and would you rather spend your time having surgery, doing rehab, or spend your time participating in the activities that you enjoy? This was a study in 2014 out of Columbia that looked at the cost effectiveness of these programs and found that you can kind of approach it in 2 ways. You can screen all players and then refer only those that are determined to be high risk to a training program, or a more better and more cost-effective approach is actually just to implement a neuromuscular training program for everybody. So in 2017, the International Olympic Committee hosted an international expert panel, including physiotherapists and orthopedic surgeons who specialize in treating and researching pediatric ACL injuries, with the goal of addressing fundamental questions regarding the prevention, diagnosis, and treatment of kids with ACL injuries. They found that there is compelling evidence that ACL injury prevention programs work in skeleton mature patients. They reduce the number of athletes who sustain a primary ACL injury and reduce the number of new ACL injuries among athletes who return to their sport after tearing their ACL. Injury prevention programs should be implemented early in an athlete's developmental process. If you get to these kids early, then they learn to train, cut, jump, and land properly, and these movement patterns become kind of ingrained forever. So like if you teach a kid to throw a ball or swing or bat properly from an early age, then they'll always do it that way forever. These injury prevention programs target movement patterns by incorporating strength, plyometrics, sport-specific agility training, and then also training the coaches and athletes on proper cutting and landing techniques. Finally, those involved in youth sports and clinicians who treat pediatric ACLs have a responsibility to actively advocate for injury prevention in both a primary setting and for children who return to sport after an injury. So not only are we trying to prevent injuries and keep kids out of the operating room and off the sidelines, but we're also trying to avoid the long-term consequences of ACL tears, and that's kind of shown here in these pictures. These are actually two of my patients who've had previous ACL surgery. The one on the top, he's had both his ACLs done. The one on the bottom, he's had the one on the left done, and then they ended up having this done, so knee replacements. So this is RG3 from his NFL combine testing, performing a vertical jump. You can see how poor his form is in these pictures. If someone would have maybe recognized this, then maybe they could have prevented this. So in summary, the rate of ACL injuries in our pediatric athletes is increasing. Females have a higher risk of tearing their ACLs than males. There are different risk factors that may help to explain why this is. Prevention programs like Sportsmetrics are effective in reducing ACL injuries by focusing on neuromuscular patterns. So, we want our kids to stay in the game, not have their careers shortened and suffer the long-term consequences of ACL injuries like RG3, who now spends his time in the booth calling games rather than playing on the field.
Thanks, Dr. Brown. So next, what we're going to just kind of go over, Kelly and I, is just the program itself and some of the data. Dr. Brown already touched on a lot of it, but we are all believers in the Sportsmetric program. It works. We've had now, how many did we do last year? How many girls we have to go through it?
29.
29 girls go through it last year, which was really our first year providing it as a whole in a group setting. And we've done free assessments for girls the last 2 years as well. We've gotten pretty good turnout for those. And overall, we'll go over it, but next. So what we do every session, we start with a dynamic warm-up to get them using sports-specific motions and also preparing the body for activity. And then we have every 2 weeks, we get a new set of jumps. Some stay same throughout the entire 6 week program, and it's 3 times a week is what is recommended. So first, phase 1, we're really trying to hammer home technique in these individuals. The fundamentals will then come in weeks 3 and 4, and then weeks 5 and 6 are focused on performance. Again, phase 1, so we develop proper form and technique, emphasis on posture, body alignment, and control. So again, here are the jumps I can demonstrate. So wall jumps are pretty much just more ankle bounces. But again, time jump, focusing on giving verbal feedback to the individuals so that they know what they're doing wrong, they're able to correct it, and over time, trying to build up the correct form and the body muscle memory. So followed by tuck jumps. These ones are rough, but again, so we're just trying to land and trying to hammer home soft landing, knees over toes, not allowing the knees to come in like the video showed with Robert Griffin. A lot of times what we'll see athletes doing is when they come down to jump and when they go to jump off, knees are coming in. So we're trying to coach that and teach that. And then also with the landing, again, we're gonna try to make sure the knees are not coming in. The squat jumps, which personally is probably my favorite jump as a whole, because we allow, what we're trying to teach is coming back on the heels, and they've got to touch the back of their heels, so it's almost forcing them to land softer with more bend in the knee, which is a good thing. We want more cushion in the knee, so the more bend, the less stress they're putting on the knee. And we've got barrier jumps, which are kind of just, everybody's kind of seen the line jumps that they maybe do in gym class, but it's just up, over, and up and over. Again, everything's timed, but just trying to focus and hammer home the proper landing technique and jumping technique. The 180 jumps kind of explain themselves, but we're up and over. Again, trying to tell them not to twist, but focus more on jumping up and then straight over, trying to eliminate the twisting on the knee. The broad jumps, which everybody's kind of seen through sports as a whole. And then the last one, which a lot of people probably don't see, but bounding in place is a jump that it's really causes the individual to have to think and react, but we're just kind of driving the knee up and trying to land on one softly, and then being able to drive right back up in place. So they're not moving, and the whole time trying to stabilize that knee. So the fundamentals, we're trying to build on the skills developed in the first 2 weeks and transition of proper technique from 2-foot activities to single leg hops. Okay, and as you can see, some of the jumps remain the same throughout. So we've got wall jumps, tuck jumps, they don't change. Okay, the squat jumps are there. The barrier side to side, I believe during this week, is one single-legged. And we also do frontward, backwards. And then we also add scissor jumps to this one, which are more of a, we're again trying to get them low. They're jumping up and really trying to stabilize that knee. And as you can see, for me being out of breath after just doing a few, the times change throughout from 30 seconds to 45 seconds. But an added benefit of this program, which isn't the intention of the program itself, but they're going to get conditioning out of it too. And also, there tends to be an increase in vertical jump. Obviously, that's not what we're trying to do with this program. Obviously, we're trying to eliminate non-contact injuries the best we can, but those are just kind of some of the things that luckily we get out of the program. And then the last week, we enhanced the basic skill and muscle control. We combined some skills from the previous phases. Again, you can see the wall jumps don't change. We incorporate boxes or pads in this, and again, trying to stabilize that knee, also causing the body to have to think and react, including the mattress jumps, which again, it adds a different dynamic to it, making, again, the individual, the athlete, have to focus on stabilizing the knee. And again, we go to the hop stick, which is a single leg hop stick. Again, just trying to focus, again, technique over everything, but also stabilizing the knee. And then the jump into bounding, which they'll do an actual jump from here into bounding. Okay, all the while they're getting one-on-one instruction. Okay, I think that's the biggest key to the whole program, is that we can't do too many athletes at a time. Okay, I can watch 6 athletes at a time if I'm by myself. Okay, usually we have 2 instructors there, so they're really getting a lot of one-on-one attention. They're getting a lot of feedback, which is huge. They're getting a lot of verbal cues, demonstrations, all while really focusing on that. She played basketball and she runs track. She's a senior, Luckily, never had an injury herself. In my opinion, had she not gone through the program and continued, the high likelihood could have been relatively high. So when we started with this individual, okay, when we went through the assessment, she was extremely, extremely weak, in my opinion, in the lower half. So within the assessment, the initial assessment, we performed 3 tests. And what we're looking at is we put balls, styrofoam balls on the sides, down their legs, and it lines up with the board that we have, and it calibrates what their hip angle is, what their knee, ankle, all angles that, again, like Dr. Brown talked about in his presentation, that may put females at higher risk for ACL injuries. Okay, so in this, we do a drop jump test, which is they're on a 12-inch box, they jump down, and immediately upon, they do a vertical leap. And what we're looking for, again, is where their hip, knee, and ankle angles are upon initial landing, their deep landing, and then takeoff. Okay, so we want to see what those angles are when they initially land, when they're in their deepest point of their squat, and then again when they go to jump off. And then we have a single leg squat, which they're trying to go as low as they can off the box, tap the ground, all while maintaining control and stability of that knee. And then a single leg triple hop that we do measurements on for distance as well. But just like the single leg hops I demonstrated, they're trying to go as far as they can 3 straight times in a row. Okay? So some of the numbers you can see here, we've got improvement across the board. Some of it, you might sit here and think, well, she's still at a pretty good angle there, which she is. Again, if she wasn't a senior and was coming back to play athletics, I would certainly recommend to her and her parents, again, doing the program. And sometimes the stats don't do it justice. I mean, if you can kind of see the pictures here, we'll see the videos here in a minute. But so here's just the initial drop jump test, and you can kind of see on landing on the, and we want to, what we want ideally is her to jump immediately upon landing, but sometimes we just got to work with them. But I think if you could see the video, the way she lands, the bend in the knee, the reduction in the valgus in her knees, I think the video does a lot more justice than what the statistics on the paper show. But we had improvement across the board. So we had 5 percentage points better post, and then we also have a better angle on the ankles. Ideally, what we want would be 80%, but the closer we get to 100, the better. But we picked her because we think she was a great example of somebody who improved greatly, but also somebody, if she wasn't a senior again, we think that she would improve if she went through the program again as well. So again, the numbers kind of speak for themselves. I think the videos do a better job. So here's her doing the single leg squat. Prior to, she couldn't do it. Like she'll mess up here on the next one. She didn't have the strength to complete the task needed, essentially. She's going to the side, she's not in front of the box, she's losing her balance. And then on the post, you can see, obviously still not great, not where we'd want her, but the improvement is drastic. So again, the pictures kind of do it justice, more so than what some of the numbers will do in the videos. The angle reduction, I think, is fantastic. Again, I think the strength overall was improved greatly. And then the single leg triple hop here. Again, you can kind of see, I think the coordination's better. I think the strength is obviously better. I don't know, do you have the distances off the top of your head of what she jumped distance-wise? But I think just stability of the knee, I think everybody can kind of see was greatly improved. And you see the angle of the knee on the left, her knee is coming into valgus a lot more. So coming in, creating a larger angle hip to knee than what it does post.
Hi, my name is Angie Kalashewski. I am a former player at St. Paul High School. I was a high school and collegiate athlete in volleyball, and I graduated from Baldwin Wallace as a collegiate volleyball player. I have been coaching since I was 18. I started coaching JO Volleyball Olympics at that age, and then I continued on to do 8 years as head coach at Norwalk High School, and I have been currently working at St. Paul for the last 3 years as the varsity assistant. My connection to the Sportsmetrics program is through my daughter and my athletes. Last year was the first year that we did this at St. Paul, and my daughter was an incoming 7th grader, and she went through the program in the summer, as well as several of our varsity athletes. The benefits I saw with the Sportsmetrics program was a lot. I watched many of the sessions, and I saw my daughter not only increase on her ability for jumping, stability, and landing, but also an unexpected increase in her vertical, which was great to see. My daughter will definitely be continuing through the Sportsmetrics program, as well as my other daughter when she is old enough. We are also encouraging all of our high school athletes to think about it and learn about it and see if it's something that they think they would like.
Just to touch on kind of what we're looking for in somebody who would qualify for the program. She said her other daughter would go through it when she is able to. So incoming 7th graders and up are eligible to participate in the program. So males, obviously the program is intended for females like that. We think that's who's going to get the most benefit out of the program. But we've had a few males go through the program as well and seen benefits as well. So I think the program itself is beneficial for anybody. But again, we do have that age requirement on it. And so we did do the free screenings. Happy to reach out if anybody has questions or would like to set up a free screening to help make the decision if they think they should put their athlete and their kids through the program. Happy to do free screenings. Come to you, come to us type of deal. You can contact the physical therapy department, or some of the parents have my information as well. Feel free to reach out if you have anything to add.
Do you guys have any questions?
When do the classes start?
June 6th, Monday.
Okay. Well, that's so we start June 6th with the hope of being done prior to the start of athletics August 1st, when things really get going full steam ahead. We do give ourselves a 2-week buffer in there, so if you're going on vacation and gonna miss a week, you still get the full 6 weeks. Okay, so we keep track of where you're at within the program, and we pick up where you left off at. So we give ourselves a 2-week buffer to help in the case that you're going on vacation, and if that was going to be the deciding factor if you're going to put your kid through the program. We certainly don't want that to be a deterrent, and we'll certainly work with you.
How many days a week and how long is each session?
3 days a week, 6 weeks. Each session ranges from 45 minutes to an hour.
So a lot of athletes have their own team lifts in the summertime. Would you recommend them just stick with Sportsmetrics, or could they double dip with both?
So last year what we did is with St. Paul Volleyball, we did sessions after they got done lifting. We try to avoid leg days the best we can. Obviously, we're going to have some conflicts at some point with somebody, but we do it, and certainly don't encourage you to miss lifting sessions with your teams. Yes.
So you went over the different types of things that you do for the players. For example, I had 2 daughters that went through jump assessments, but the results were quite opposite. One was
her knees were too far out and the other ones were too far in. So, but is the correction the same, or are they going to have different types of exercises to correct that particular problem?
The exercises stay the same. What we might do, the individual who is doing a really good job of keeping their knees out, they might still have issues with landing softly. So providing, again, that feedback to them and giving them the cues to remember to land softer. And they might be, landing with not enough bend in the knee, heavy feet, things like that. So I think that, again, the jumps stay the same, and those are beneficial within themselves. But I think the one-on-one, the individualization that we see as specialists, being able to see that and give them the cues. Every girl's different, every guy's different, right? So I think that's the biggest part of the program is the being able to get our eyes on them and not just, all right, you gotta have wall jumps and then turn around and not watch. So.
Well, the big thing is when you get those assessments, the pictures don't do it justice. You gotta really watch the videos and actually see them. That's why we put the videos in here, because the pictures don't always do it justice on the assessments. So.
I just wanted to comment about what Madison asked. So, the lifting plus the program, in my mind, kids have been lifting now and they're getting bigger, they're getting stronger, but the rate of ACL injuries is going up. So lifting is not enough. Lifting in the off season, training in the off season is not enough to combat this problem. So to take 6 weeks of your summer and just focus in on Sportsmetrics, I think is greatly beneficial. I mean, even if you miss 6 weeks of lifting, that can still do you a tremendous amount of good in your overall performance. So don't just rely on the weight room for these kids, to get bigger and stronger. It's still not going to help prevent these injuries. So to focus in on Sportsmetrics and maybe not lift, or just maybe lift with your upper body those 6 weeks, that would be good. That'd be a benefit in my mind.
Is this offered multiple times per year cycles?
We are looking at that. We've had discussions about offering it multiple times throughout the year. Currently, it's just in the summer, but it's something that we're hoping to expand. I mean, we believe in the program, and the more kids we can get through it and hopefully eliminate a majority of these ACL injuries, we're all for it.
So you're looking at like Monday, Wednesday, Friday?
So we are doing Monday, Tuesday, Thursday sessions with Norwalk and St. Paul volleyball, and then I think based on a lot of it is outside of those two programs. Those two volleyball coaches are very interested in doing it. They want to do it with their kids. Outside of that, we can schedule kind of around, hopefully, once we see what the interest is and within the community.
Is there a standard cost?
Yeah, $175 across the board.
The whole program?
Yep. So it works out to under $10 a session, which I think is pretty reasonable.
When do you guys do the assessments, or have you already done some?
We've done, how many did we do of the assessments?
We did 37 assessments.
37 assessments so far. If you're on the fence about wanting to do it or not, please contact us. We'll set something up to do the assessment. If you're planning on doing the assessment or going through the program, we do the assessment before we start the program, and we do it again at the end. Okay. But if you want some data, pictures to support a decision that's best for you, we can definitely set up an assessment.